Did you know that there's a super common toxin in the environment that could be causing your high cholesterol, and that fortunately there is a potential treatment for it? Hi, I'm Dr. Patricia Mills, holistic medical doctor with a root cause approach to women's health, and welcome to the Wild Wisdom Show. Today we're going to be talking about how an environmental toxin could be the cause of your high cholesterol, the surprising science. And now this conversation got started when I came across this research that was published in 2000 looking at the exposure to a specific group of toxins called polyfluoroalkyl chemicals, which I will call PFAs from now on for short, and the association with high cholesterol. And this was a study done in the USA in 2010. And if you're listening to me in the podcast, you can pop over to YouTube, and in the banner, I have the PubMed ID number for it, which means that if you want to find the study, you can using this number. Now, this is an important study because the Centers for Disease Control and Prevention did find that PFAs are present in the blood of 97% of Americans. So that's a quite significant number. And I've noticed that there's a lot of research being done recently by government agencies across the world to try to understand what is the impact of this environmental toxin on our bodies and on our health. Now, this particular study that was published in 2010 looked at 2,094 participants between the ages of 12 and 80 years old. So quite a few participants. And what they found was a strong association between blood concentrations of PFAs. So the more PFA you had in your blood, the higher your cholesterol. And it was the bad kind of cholesterol. It was total cholesterol and what's called non-HDL cholesterol. So this was a very important finding. And researchers are really noticing that this is a consistent finding whenever they're looking at the association of PFAs and cholesterol in humans. Now, the interesting thing is that you are probably being exposed to this kind of toxin regularly in your day-to-day if you're not aware of the fact that these polyfluoroalkyl chemicals are present in stain repellents. So, stain repellents are very commonly used to remove stain and protect from stains on carpets, on couches, and on clothes. They're commonly found in cosmetics, some food packaging, nonstick cooking surfaces. So if you like to use nonstick cooking ware that contain things like Teflon, this is a concern. This is definitely a concern. Now, why this is a concern is because PFAs are also known as persistent organic pollutants. So they get into the environment through these sources, and then they get into your body, and it's really hard to get them out. Now, they get in through inhaling air that is contaminated with things like dust that have, for example, the stain repellent on it. If you're eating the food or eating the tainted dust, that gets in that way. And they've actually studied this to determine that this is, in fact, a source of PFAs. And absorption from treated clothing. So if you're wearing the clothing that has been treated with stain repellent, then you're going to be absorbing that through your skin. And that's one of the ways it gets in, as well as any drinking water that's been polluted with PFAs. Now, not every drinking water has high levels of PFAs, but certain areas have more than others. So it might be worth getting your water tested if you have problems with your health, including high cholesterol. Now, PFAs have been linked with other health problems such as infertility issues in women. And so it's not just related to cholesterol, but this is the focus of this conversation today. Most persistent organic pollutants tend to love going into fat tissue. So it's hard to get rid of these because it's in the fat. And really one of the few ways to burn these out of the body is to lose fat or through sweat. So things like infrared saunas or exercising. But the PFCs, they like to be stored in the blood and in the liver. And this is interesting because the liver is one of our biggest internal producers of cholesterol. And I've done an episode on this before where our body is actually one of the biggest sources of higher cholesterol, more so even than our diet. So understanding what causes the body to become unbalanced and make more cholesterol is important. And it looks like toxins like these are one of those causes. So very, very key. So the question then is, how do we detoxify PFCs out of the body, knowing that They are most likely present. They are causing issues with our health in some people more than others. And that could be a result of how much you have in your body and your body's ability to detoxify it over time. And one of the ways that the body can detoxify it from the liver is by dumping the toxins into bile, which then gets stored in the gallbladder. If you don't have a gallbladder, you still make bile. It just doesn't get stored there. It just drips out, intermittently through the day. But if you have a gallbladder, the bile gets stored in the gallbladder. And whenever you eat a fatty meal, that gallbladder squeezes, the bile gets dumped out into the gut. It mixes in with everything that's in the gut, including your poop. And then the ideal is that you poop it out. But oftentimes these toxins are reabsorbed into the body. So there's not a lot of research done specifically on detoxifying PFCs in humans, but there is enough to say that there's a promising agent which is called oral cholestyramine. So cholestyramine is a medication that can be prescribed by your family doctor or any doctor. It actually has historically been used for reducing cholesterol, which is interesting. So it may be that it works on reducing our own cholesterol absorption because it does block that ability to some extent. But maybe actually the way it's been working is to reduce PFCs. Who knows? But the interesting thing is that oral cholestyramine has been studied. And the way it works is it binds to bile acids in the gut and prevents it from being reabsorbed into the body. So it promotes the bile acids being excreted through your poop. So you poop them out. And what's interesting is that this study here called gastrointestinal elimination of perfluorinated compounds using cholestyramine and chlorella took a group of people who were found to have very high levels of PFCs in their blood. And when they did a history on them, it seemed like in this group, it was due to repeated exposure to carpet stain protectors put on carpets, particularly the carpets that are on in-radiant floor heating, which is interesting. Another study found a family that had really high levels of PFCs in their blood, and that was due to repeated use of a stain repellent called Scotchgard. So this is very interesting. What they did is they studied these people who had documented levels of PFCs being high in the blood, and they analyzed their poop before they gave the treatment for content of PFCs and then after the treatment. And they used two different kinds of treatment and they compared them. They used the cholestyramine and chlorella, which is an interesting choice because chlorella is really, really good for detoxifying dioxins, another kind of persistent organic pollutant that was studied in nursing women in Japan who were found to have high levels of this in their breast milk. And when they were treated with chlorella, the levels of dioxins reduced. So that was found to be effective. And chlorella is also effective for other toxins like mercury and cadmium, but they were studying it for the use of PFCs. And what they found was that chlorella was not very effective for reducing PFCs, but the cholestyramine was very effective. And what I mean by that is that before they started the treatment, there was very little of it in the poop. And after the treatment, there were significantly higher amounts of the PFCs in the poop after treatment with oral cholestyramine. So it was found to be an effective way. Now, the thing about this treatment, as with any medication or even supplements, there can be side effects. And in this case, it's bloating, constipation, some abdominal pain. There can be some reduced absorption of fat-soluble vitamins, so vitamins A, D, E, and K, for example, and some drugs. So if you're going to be taking this medication, it has to be with a prescription by a medical doctor, and you have to be monitored over time. And you have to understand when you should be taking it and when you shouldn't, what to avoid taking it with, which medications to not take it with, and to monitor for any side effects. So be sure to do that if you decide that you want to try this as a treatment for your high cholesterol. Now, there's only been a few studies done on humans for the purpose of reducing PFCs, but there's been more studies done on humans for cholesterol lowering effects. So there is some idea as to how much there should be used. And the optimal dosing and timing is not yet known, but one study showed that cholestyramine 3 times a day at a dose of 4 grams 3 times a day for 28 weeks did significantly reduce PFCs in the body by increasing the excretion through the gut. So typically the doctor will start the patient on a dose such as 4 grams once or twice a day. And then if it's well tolerated, as in it doesn't cause that kind of belly pain or gut upset, they can increase the dose, and that's how it's usually done. Now, to be fair, though, the biggest intervention that needs to be done to reduce PFCs in the body is to reduce the amount coming in. And that really is reducing the use of non-stick coated cookware, including products such as Teflon, reducing the use of certain food packaging products, including microwave popcorn. That was found to be a source of PFCs. Fast food and frozen entrees, for example, the stain protectors on the clothing and the carpets and the upholstery of our furniture, and the other sources mentioned before. So you really want to make sure that you are addressing all of these potential ins as you're increasing the outs. So what you want to understand is that this is one of the toxins that has been the most studied so far, but there are other toxins in the environment, such as air pollution, that are gaining recognition for causing high cholesterol. And the way that they seem to cause high cholesterol is through inducing inflammation. So inflammation in the body causes the body to make more cholesterol. And so that can be another cause. So just being aware that if you are battling high cholesterol and it doesn't seem to be getting better with your approaches to improve it through, for example, diet and exercise, then toxins could be the next step in addressing. And speaking with your doctor, you may need to share this video with them in order for them to understand the science, and they can look up the research using the PubMed IDs that I shared. And really the good news is that cholestyramine is a very common medication. It's been around for a very long time. It's very well understood. And there's dosing parameters for high cholesterol that can be used. And so doing a trial of about a month to 3 months and then repeating the blood work to see if it's been effective would be a useful next step for many people. But of course, speak to your doctor about this. Don't do this on your own, because there can be issues from taking cholestyramine without medical supervision. And always communicate with your doctors and the pharmacy. The pharmacist is an important member of your healthcare team. If you're taking any medications, you want to be sure you're not taking the cholestyramine near medications that could be affected by the use of this medication. Now, what I want you to understand is that there are many, many ways to tackle high cholesterol, and usually one way is not enough. You need to look at it holistically. You need to understand the other kinds of toxins that can cause it, such as too much alcohol can be a cause, too much sugar can be a cause. And there's certain tweaks you can make to your diet that actually don't even involve cutting down high cholesterol foods. Research has shown that that's not the cause of high cholesterol. So if you want to learn about supplements and diet and exercise and other root causes of cholesterol that you want to make sure you address, please be sure to check out the caption in my YouTube channel. You look down below the video, click on the more, and it'll expand to show you all of the resources. And I will share with you my high cholesterol playlist, where all of the episodes that I have ever done on this topic are going to be there. So be sure to check that out. If you enjoyed this, please subscribe. That's the best way to support this show, and save so you can find it later, and share, because sharing is caring, and you never know who's going to benefit from this wild wisdom. Thank you so much. I look forward to seeing you next time. Bye now.